Congratulations on completing your 6-week stay in San Francisco after your lung transplant. We are ready for you to go home and to live your best life for both yourself and your donor. We are your transplant team for life, and we look forward to helping you succeed in your transplant care. We would like to review some of the educational material that has already been presented to you and discuss some of the common issues that pop up when patients go back home. First, we would like to stress how important it is that you communicate with our team. You have a transplant nurse coordinator who is your main point of contact with our team. It is very important that you contact your coordinator when you have any change in your health, even if it's not related to your lung transplant. The coordinator can give you the best plan of care for the issue. Always report any change in your health status or breathing, including shortness of breath, fever, new cough, or chest pain immediately to your transplant coordinator. For urgent issues, if you are unable to reach your coordinator right away, please call our main line, 415-353-4145, and ask them to contact your transplant coordinator or the lung transplant doctor on duty to tell them about your issue. Remember, when in doubt, give us a shout. For health issues that are not related to your transplant coordinator will likely direct you to see your primary care doctor or PCP. But please know that your coordinator will also discuss all of your health issues with our doctors and other team members and reach out to your PCP to provide help and advice. On the other hand, if you have a visit with your PCP or with another healthcare provider, please report this to your transplant coordinator so that our team can follow up with the provider to answer their questions or concerns. Our team needs to know if any new medications or treatments have been prescribed by your PCP or other providers so that we can evaluate those medications or treatments for any troublesome interactions with your transplant medications or side effects that may occur. The familiar phrase, "it takes a village," applies to your transplant care. Our lung transplant team addresses many issues when we see you in clinic, but we rely heavily on your PCP and other healthcare providers to help manage the healthcare needs that are not related to your transplant. While we manage your lung health and look at all health issues when we see you in clinic, you will also need to have regular visits with your PCP and other specialists to help us keep you in the best possible health. You will need to stay up to date on all of your preventive care and regular health maintenance needs, such as vaccinations, colonoscopies, and mammograms. We ask that you make an appointment with your PCP as soon as you go home from your 6-week stay in San Francisco. Make sure they know how to reach our office for questions or concerns. Your primary doctor will continue to manage your non-transplant medications after you get home and reestablish care with them. In addition, if you saw any other specialty doctor before your transplant, it is very important that you reconnect with them to update them on your current health, your medications, and to discuss with them how often you need to have appointments for follow-up in their office. Always bring your blue medication card to every medical appointment with any of your providers so they can see the most up-to-date medications and dosage information. Next, let's talk about infection and rejection. Both of these issues are very serious, and they can often cause similar symptoms, including but not limited to fever, being really tired, having shortness of breath or a cough, and just not feeling right. You take several anti-rejection or immunosuppression medications that allow us to help to keep your immune system from attacking your transplanted lungs. But the side effects of these medications cause you to be at higher risk for bacterial, viral, and fungal infections. Keeping your immunosuppression medications within a specific range by checking the levels in your blood allows us to help you avoid both rejection and infection. We can have great success in avoiding serious issues only if you do your part. This means always taking medication on time and as prescribed by our team and sticking to a regular lab schedule. You will always be at risk for rejection and infection for the rest of your life. it is vital that you avoid sick contacts, even if they are friends or relatives, as your immune system will always be weak and you will always be at a high risk for infectious illness. Remember to screen anyone that will be having in-person contact with and to reschedule activities with them if they have symptoms of illness or if they have had contact with an ill person. If you learn that a friend or loved one has been exposed to illness or is having symptoms of illness, please reschedule your visit with them. No visit is worth risking your health and possibly your life. Our third topic is that of compliance with your transplant care. This means that you need to follow the instructions and safety practices being given to you by our team. Compliance is a part of transplant over which you, as the patient, have complete control and responsibility. Your health and the path to your quality of life rely heavily on your compliance with the schedule given to you by our team. This includes compliance with medication doses and times, required lab visits, imaging, bronchoscopy procedures, and pulmonary function testing. Sticking to the program is the best way for you to have some control over your transplant outcome. Doing your part to follow the plans given to you after transplant allows our team to review medication lists, lab results, and testing results with the confidence that you have followed your routine as expected and that your lab results are accurate. Lack of compliance with your transplant medications and regimen is dangerous to your new lungs and your health and affects not only you, but those who support you. Remember, take your meds at 9 and 9, labs at 8. Please be on time. Another important part of compliance is to always have enough of all of your medications and to never run out of your transplant medications. When you receive your pill bottles and they say no refills, that is the moment to contact your pharmacy to tell them that they need to call our team for a refill authorization. Do not wait until you are down to a few pills to call your pharmacy or your transplant coordinator to place a refill order. There are often stopgaps with insurance companies that cause delays in refilling medication. So following the simple routine of notifying your pharmacy when you are on your last refill is extremely important and will keep you on track with your daily medication routines. Let's move on to getting your life back. You are going home, but with a more complex way of life than before. You are not just resuming your old routine, but have new routines and responsibilities for your health. So you need to find ways to make your new routines fit into your old lifestyle. You have a new normal. First, resuming your social life. We know that you will have friends and relatives who are anxious to see you in person and to celebrate your new health. While it's wonderful that so many others care about you, it is important that you limit the chance that you may be exposed to infection. This can be managed politely by setting rules for in-person visits, including pre-screening visitors by asking about ill contacts, vaccination status for COVID and flu, and any current illness symptoms they may be having. If they have illness symptoms, have been around anyone who is ill, or are not vaccinated for COVID or flu, it's best to reschedule a visit until they are feeling better or vaccinated, or simply video visit with them. Leave a bottle of hand gel near the door where guests enter your house and ask that they gel their hands as they enter. This protects you and reminds them of your special immune-compromised status. Next, going out in public. It's going to be great to get out in the fresh air and around your favorite spots again, especially after having been ill and hospitalized and keeping up with your busy schedule for the past 6 weeks. Keep the following in mind. Wear a mask when you are in any high-risk or crowded space and where you are unable to social distance from the public. This includes spaces such as hospitals, pharmacies, clinics, elevators, crowded shopping centers, meetings, public transportation, or airplanes. Wearing a mask to prevent infection was in place for lung transplant patients long before COVID came to be. It is a gold standard for preventing infections in our patients. Try to go to restaurants and other indoor activities at non-peak or off-hour times to avoid crowds and to decrease the risk of infection. Make sure restaurants that you visit are clean and rated highly for food safety by the local health department. Remember, no raw meat, eggs, or fish. Please do not drink alcohol for at least 6 months, as it may cause some of your medication levels to be abnormal. Ask our team to see when it is safe to drink a small amount of alcohol. Limit family or social gatherings to a number that allows for safe social distancing, and be sure to remind those coming that you are a transplant patient and that they need to let you know ahead of time if they have any illness symptoms or exposure to illness so that the event can be rescheduled. Try to schedule or attend events that are outdoors as much as possible so that the risk of spreading infection is less. You can start to drive again now that you have been out of the hospital for 6 weeks. Please avoid twisting your upper body to look into the back seat or to get in and out of difficult parking spaces, as the wires in your breastbone can break and cause new and painful problems for you. Physical activity. Now that you can breathe like a champ, our team wants you to push your new lungs to work as they were meant to. Exercise is your friend and is a huge contributor to your success as a lung transplant patient. You should exercise at least 30 minutes daily. Walking is the easiest exercise for you at this time, but you may take up running or swimming after 6 months. Gyms are okay if they are clean and not crowded, and if there is cleaning solution available to wipe down the equipment. Always wait 5 minutes after wiping down equipment to use it, allowing the cleaning solution time to kill any germs. Always use hand gel between pieces of gym equipment, and wear a mask if there are other people in the gym when you attend. Check with your transplant coordinator before doing any strenuous exercise, including weightlifting, rock climbing, or any activity that puts strain on your chest and sternal wiring. We never like opening your chest again to do repairs. If you need help establishing an exercise routine or are worried about the ability of your new lungs to handle physical exercise, ask your transplant coordinator to help you find a pulmonary rehab program near you. This is an excellent way to kickstart your exercise routine and to have a healthcare professional help you develop good habits and techniques. This will improve your lung function and overall health. Returning to work. If you plan to return to work, discuss it with your team. It is important that you have enough time to heal from your illness and surgery. We usually recommend waiting at least 6 months before returning to work. Please talk with your transplant coordinator to see if your individual health needs can be met safely at your job. In addition to the concern of safety, there may be insurance changes or financial concerns that should be reviewed by our financial counselors. We want to make sure that your care and medications will still be covered by your insurance plan when you return to work. Your coordinator can put you in touch with our financial counselors to help with these issues. Our team realizes that work may be important for your financial well-being and that it can be important to your self-esteem and overall happiness. You will need to continue to manage your transplant appointments and medication routine while working, and your coordinator can give you the best advice on juggling your care while returning to work. Traveling. We know that you have probably missed traveling and the adventure and pleasure that it brings. Our team wants you to be able to travel again safely and successfully. Just follow these simple steps. Plan travel with a great deal of advance notice so that our team can make sure you are good to go. Be aware of your transplant appointments when planning travel dates. Research medical facilities near your travel destination. Notify your coordinator about travel plans before buying tickets and/or well in advance of your trip. They will help you with decisions about safe travel and how to make sure your medication supply is adequate. Be sure that you have an ample supply of medication before leaving on your trip. Be sure to research any special vaccinations needed to travel to your destination. And lastly, take zillions of pictures to share with our team when you return. Your home environment. There's no place like home. Now that you have returned home, you need to be sure that your routines and your home environment are healthy for your new lungs and your compromised immune system. It is important to check your home frequently for existing mold or mildew and for any issues that may lead to growing mold or mildew. Mold or mildew can lead to infections in your new lungs and cause terrible problems there. Make sure to use high filtration air filters in your heating and cooling system and change these monthly to keep the air in your home as clean as possible. While houseplants are beautiful and add joy to your home, be sure there is no standing water in the base of the container. Inspect the container for any crusty residue. Do not touch the soil, the dirt, or the crusty residue that collects on the outside surface of the plant containers. All of these issues may expose you to fungus that can cause serious infections in your lungs. Clean your shower head monthly by detaching it and soaking it in bleach water to kill any mold or mildew that may be growing inside of it. You should not have direct contact with soil or plant chemicals inside or outside of the home. If you're going to do any work with plants outdoors, you should wear gloves and a respirator mask. You should not work in areas inside or outside your home where there is dust or lawn debris in the air. Avoid using cleaning chemicals, especially sprays that irritate your airways. Ask for help with house cleaning and stay in another area of the house while chemicals are in use. Please do not allow smoking in your home, as secondhand smoke is a danger to all. Now that you're going home, you should start planning for your future healthcare needs. Our team provided you with transplant appointments for your first 3 months after surgery. Work with your transplant coordinator to make sure that you always know the appointment dates for your follow-up care. In addition to care of your lung transplant, again, please have your regular health maintenance managed by your PCP and any other specialty provider you saw before a transplant. This includes OB/GYN care for women, such as pap smear and mammogram, annual dermatology visits, and annual wellness checkups. You can see your dentist for teeth cleaning and a checkup 6 months after your transplant, and you will need to take a dose of antibiotics 1 hour before your dental visit. Your transplant coordinator can send the antibiotic prescription to your pharmacy. You can have your annual flu shot 6 months after your transplant and should have them yearly after that. Before your yearly transplant anniversary visit to our clinic, ask your primary care doctor to order the following items so that we can review them at your visit: EKG, echocardiogram, dermatology consult, bone density scan, mammogram for women only, pap smear for women only, and a prostate-specific antigen test for men only. These tests give us the best picture of your overall health and valuable information about the effects of the medications on the rest of your body. If you have a change in your primary care provider or any other providers you have seen outside of UCSF, please notify your transplant coordinator. It is important to your overall care for our team to be able to work and communicate with your providers. In addition, please notify us if your address or phone number changes, as we need to be able to reach you at any given time. Accurate insurance and provider information are very important for scheduling and receiving your transplant care. If you have a change in your insurance or you lose your insurance benefits, please notify your transplant coordinator immediately. Your coordinator will request that one of our financial counselors work with you to make sure that you have adequate insurance coverage. Now that you are ready to re-enter your life outside of the UCSF campus, let's talk about the support that you received from your family and caregivers while you were ill and recovering. They helped you get this far and will continue to help you through the ups and downs you'll have going forward. Practice gratitude. They stepped up when you needed them and now deserve some extra thanks and care from you for their time and effort. Before I go, I would like to remind you to always honor your donor. Your lungs are a life-saving gift given to you to bring health and joy to you and your loved ones. You may never know from whom or where your lungs came, but they came from another human being just like you. Treat them as you would a newborn child, carefully and protectively. Never forget this amazing act of kindness and humanity. A second chance to live life's dance is a gift for you to cherish. An organ gift is a mighty lift. Please do not let it perish. Honor your donor.